India's public healthcare system is failing hundreds of millions of people who live in poor rural areas. India spends only about 5% of its GDP on medical care, a tiny amount compared to, say, 15% in the US. And of this money, only a fifth is spent on public healthcare. There's a critical shortage of hospital beds. India needs another 2.2 million just to meet the needs of people who do have access to healthcare. 53% of India's children under 5, that's 67 million kids, lack access to even basic healthcare. That's largely because 72% of India's population live in rural areas, while 80% of doctors live in towns and cities. Prerna Suri reports from Andhra Pradesh on the growing medical care available to the rich and the lack of it for the poor.
The Prasads have walked over 8 kilometers to reach the only hospital in their district. Inside, the wait is endless. Patients, some critical, huddle together. And hours later, there's still no sign of a doctor.
They don't provide us with proper treatment here. Sometimes they see us, but many times we've just been turned away.
Although India boasts world-class private medical facilities in its cities, the story is completely different in its villages. 66% of rural Indians still don't have access to basic medicines. This is the only hospital catering to 35,000 people in the area. Patients have travelled for miles on end to receive treatment, and the facilities here are very basic. This is the state of affairs for many of India's public-funded hospitals in the rural areas, and doctors say they're working with very limited resources. The resident doctor finally checks Gangamani's daughter. She's suffering from severe diarrhea, a simple problem to treat, but a disease that can kill if left untreated. Doctors simply refuse to work in rural areas because they can make more money in the cities.
Their wages are very minimal, and they are facing this education of their children. So there is a problem that most of the new recruits are not willing to come to the rural areas.
Dr. Rajmouli shows me around his hospital. Wards are filled with patients getting basic medical care for their diseases. V. Prabhakar, a health activist, tells me there's another problem too. Widespread corruption has ruined the public healthcare system in Andhra Pradesh.
The doctors who are supposed to be working here are running their own private clinics, and the pharmacists who should only dispense medicines are actually treating the patients here. They're even selling the medicines which are supposed to be free of cost.
After a long day's wait, Gangamani's family finally get the medicines they're entitled to. But it hasn't been easy. Lack of political will has meant that quality healthcare still remains a mirage for much of rural India. Prerna Suri, Al Jazeera, Andhra Pradesh.